All right, so this is skill 2.22, preparing medications from vials. So vials are, you know, they look like this, okay? They can be glass, they can be plastic, okay? They can be any med, okay? They can also be a powder format, okay, that you have to add liquid to in order to, you know, extract the medication. So with a powder form, you have to make sure that you are looking it up in Nursing Central. You're looking at the label. You're seeing how much liquid meaning sterile water or normal saline. And Nursing Central and the directions for the powder will tell you what solvent, what liquid that you're putting in here to make a solute, okay? So the solvent, which is normal saline or sterile water, will make a solute. That is what you pull out, okay? Now it'll tell you exactly how much to put in of the solvent, okay, in order to get the correct dosage of medication. If you put in too much, you dilute the medication. If you don't put in enough, you make it more concentrated, so the patient is receiving either too much medication or too little medication. So it's very important that you put in the correct amount of solvent into the medicine, okay? All right. So we're going to prepare medication from a vial. So that means that we are in the medication room. We are not in the patient's room, and we've taken our medicine out of the storage area, okay? We've washed our hands and we have gathered our supplies. So what are our supplies? Well, you're going to need a vial of medication, whether it's the powder form or liquid. For this purpose, we're going to use a liquid. It's already done, okay? You're going to need alcohol pad or pads. You're going to need a needle and a syringe. You're going to need a bottle of sterile water or normal saline if you had a powder, but we're not going to do that for this video, okay? All right, so you're going to mix the medication solution as needed by rotating the vial between the palms of the hands. So we're not going to take our vial and violently shake it to make sure that the medicine is all shooken up, okay? Because what are you doing? You're putting bubbles in your solution, okay? So you don't want to do that. So you're going to take it and you're just going to roll it in between your fingers, okay? Just roll it back and, whoops, you don't drop it. Roll it back and forth, okay? If you were to drop this, okay, you would have to look and say, oh, a lot of bubbles, so be careful, okay? Or if it was a glass bottle, you wouldn't want to use it, okay? Because you could actually have broken off little minute pieces of glass inside. So you would discard that and get another medication, okay? So there, you learned. All right, so we're going to remove the protective cap from the vial. When I say that, most vials that are brand new will come with some sort of a protective cap on the top. Okay, it's either blue, yellow, green, orange, gray. It doesn't matter. Okay, it's just a protective top. You can't put a needle into it. Okay, it's plastic. All right. So what you do is you just snap it off, and what you do is just push up with your thumb, and it pops right off. And see how you got the rubber part now where you can insert a needle. Okay, so you're going to remove that, and some vials you're able to do multi-dose. Okay, so this one is a multi-dose vial, and so that means that somebody's already popped this protective cover off before and has withdrawn some of the medication. So you want to reuse this, okay? Per your facility policy, some vials will be a multi-dose, okay? So what do? Okay, well, it's already been used. It's got microbes on the rubber part. So you take an alcohol pad and you wipe it off. Circular motion, clean off that rubber hub. Okay, just clean it right off, just like this. All right. Now, while you're getting your syringe ready, you can leave the alcohol sitting right on top of it. That's fine. Or you can just put the alcohol to the side and leave this sitting on the counter. You're going to get your needle, okay? Now, you're going to make sure that the needle is firmly on your syringe, okay? When I just picked that up, that needle wasn't firmly on. It was just kind of setting on there. So I'm going to turn it and make sure it's firmly on my syringe. Okay, then you're going to remove the cap from the needle, and you're going to draw back on the syringe the amount of milliliters that you're going to take out of for medication. Okay, so you want to instill air into this syringe, the amount of medication that you're going to take out of the vial. Okay, so for this, we're going to do a whole 3 milliliters. Okay, so I'm going to pull back on the syringe till I get to at least the 3 milliliter. Now, it doesn't matter if I put 4 milliliters of air in here if I'm only going to take out 3. No, not really. It doesn't. Okay, you want to do at least 3 milliliters. Okay, so we've got 3 milliliters of air in here. What we do is we leave the vial on the counter. Okay, so on the counter, and you're going to take and you're going to put the needle into that rubber stopper on the top. Okay, and you're going to instill the air without putting the needle into the liquid in the bottle. Whoops, see if I can turn this. We don't want to do this. We don't want, when we're putting it in, to get air in there. Did you see that air go in there? Let's see if I can do it again. Okay, watch. See, there was air that got, I instilled air into the liquid. I don't want to do that, okay? I want to just instill 3 milliliters of air into the air space that's already there. So I'm just barely putting my needle into that stopper, okay, and instill air, okay? Now what I want to do is I want to invert the bottle. So I'm going to turn the bottle upside down while holding on to my plunger right here, okay? See? Now, when it's a multi-dose, it may leak. It may leak from here, and that's okay. Okay, see that leakage? That's all right. Don't worry about that. Okay, so what you're going to do is you're going to, look how it's just automatically putting it in there because I've put some air. Okay, so what you're going to do is you're going to draw back until you get to the 3 milliliter mark. Okay, got it? You're going to hold on to the plunger, hold on to this part, flip a little, okay? Get that air out of there, okay? Make sure you're at the 3 milliliter mark and withdraw your needle. Okay, now you have 3 milliliters of medicine in your syringe, okay? Okay, and then you recap. How do you recap again? That's right. The cap, the needle cap stays on the counter, and you scoop the cover up onto your needle, okay? So now we have 3 milliliters of medicine in the syringe. Okay, so now remember, we're still in the patient, no, we're not in the patient's room, we're in the medicine room. So we have to go from the medicine room to our patient's room, and that may be a little walk. Okay, so you have to take and label this medicine. Anytime that you put medicine in a syringe or add medicine to a bag, you have to label that with what the medicine is that you have for it, that you've put in. Okay, so again, you want a label, and what's going to be on that label is the medication, the dosage, the date, the time, and the initials. Okay, I just wrote the words. You would actually put what it is, okay? And you want to put it on, okay? You want to put it on as far down as you can here, okay? And you just feed it onto itself. Just like this, all right? There you go, okay? Now, I've covered up my medicine. What else could you do? You could put it on the cover, right? Because the cover's not going to be there, right? So we could have put that on a cover. Let's see if I can get that on there. I'm probably going to have to tear it. Yeah. there we go. So we could have put it on our cover like this, right? There we go. So now I've labeled it, but I haven't covered up my medicine. I can still see how much medicine is in there, right? Okay. Now, if you're in a facility that scans, you're going to have to take this with you in order to scan the medicine, right? Okay. So you take your medicine and your syringe and you go to your patient's room, okay? All right, so that, oh, I guess I should have told you that, right? So we removed it. Whoops, I forgot about that. So I just do it and forgot to tell you, right? Okay, so we have the medicine in there. We've withdrawn 3 milliliters, right? Right? Well, we think is 3 milliliters of medicine, okay? So I notice I have a little bubble in there. Can you see it? See it? Okay, you're gonna tap it. Make sure you get all those bubbles out of there. And then you're gonna look to see, is that plunger really on 3? No, it's not. So I'm gonna make sure that I'm eyeballing it, okay? And I wanna push that medicine up, dispose of the medicine wherever my facility tells me to. I'm gonna make sure that my plunger is on the 3, okay? So now I look and I have actually 3 milliliters, which is the correct dosage for this medication, okay? All right, so that is skill 2.22, preparing medications from vials.